Welcome to UMCC Medical Consultants Connectors, where your health matters to us. What comes to mind when you think about injections, pain, fear, or are you among those who believe injections are the quickest way to get well? In the world of medicine, there are few things as misunderstood as the simple injection. One common misconception is the belief that injections are always painful. While there might be a brief sting, the pain is usually minimal and fleeting. Another misconception is the idea that injections always cause harmful side effects. In reality, serious side effects are quite rare, and are often the result of individual allergies or incorrect administration. Another prevalent myth is that injections are the ultimate treatment method. While injections can deliver medication directly into the bloodstream, making them effective for certain conditions, they are not universally the most effective treatment for all ailments. So before you let fear or misinformation guide you, remember that knowledge is power. Now that we've cleared some misconceptions, let's delve into the process of giving an injection. Administering an injection isn't as simple as poking a needle into someone's skin. It's a meticulous process that requires knowledge and skill. To begin with, preparing the injection site is crucial. It's all about cleanliness to prevent infection. You'll need to wipe the area with an alcohol swab, usually in a circular motion from the center outwards. Allow the alcohol to dry naturally, as blowing on it can introduce bacteria. Next, selecting the right needle size is key. The size of the needle depends on the type of injection and the patient's body size. For instance, a subcutaneous injection, which goes into the fatty tissue under the skin, requires a shorter, thinner needle. An intramuscular injection, on the other hand, which goes into the muscle, requires a longer, thicker needle. Now, drawing up the medication is a step that demands precision. First, you'll need to ensure you have the correct medication and dosage. Do a quick check of the medication's name, concentration, and expiry date. Then pull back the plunger to fill the syringe with air equal to your medication dose. Inject this air into the vial, then draw out the correct amount of medication. Injecting the medication is the step that often makes people nervous. But remember, it's all about technique. For a subcutaneous injection, the needle should be inserted at a 45-degree angle. For an intramuscular injection, a 90-degree angle is the way to go. Insert the needle swiftly and smoothly, then slowly push the plunger to release the medication. Finally, aftercare is a step that shouldn't be overlooked. Once the injection is complete, carefully remove the needle and apply a clean cotton ball or gauze to the injection site. A gentle pressure can help stop any minor bleeding and reduce bruising. Knowing these steps can help demystify the process and reduce any fears associated with injections. Injections are a common part of healthcare practice, but what should you remember about them? Let's recap some of the key points that make injections a vital tool in healthcare. Firstly, the importance of using the correct technique cannot be overstated. It's not merely about pushing a needle into the skin, there's a science and an art to it. Knowing the right injection site, the correct angle of entry, and the appropriate speed of injection all play a crucial role. A properly administered injection can maximize the effectiveness of the medication, minimize discomfort, and reduce the risk of complications. Secondly, injections serve a unique role in delivering medication directly into the body. They bypass the digestive system, providing a fast and efficient route for medication to reach its target. Whether it's a life-saving vaccine, a dose of insulin, or a pain reliever, injections ensure that the medication gets where it needs to go when it needs to get there. But it's not all about the injection itself. The third key point is the need for good aftercare. Once the needle is out, the job isn't over. Proper aftercare can prevent complications such as infection, inflammation, and discomfort. This includes applying pressure to the injection site to minimize bleeding, cleaning the area with an antiseptic wipe, and monitoring for any signs of adverse reactions. Furthermore, it's important to remember that each individual is unique. What works for one person might not work for another. Personalizing the injection process, from choosing the right needle size to adjusting the injection technique, can greatly enhance the patient's experience and the overall effectiveness of the treatment. Lastly, let's not forget about the psychological aspect. For many, injections can cause anxiety or fear. It's essential to provide reassurance, clear information, and a calm environment to help alleviate these feelings. Injections might not be everyone's favorite, but they are an essential tool in healthcare. With clear understanding and proper technique, they can be administered safely and effectively. UMCC, your ultimate medical consultant connectors.